Hello everyone. Have you ever wondering what is ethics in psychology? Ethics is referred to moral principles that guide human behavior. It helps individuals to distinguish right from wrong. In psychology, ethics are very important because it helps to protect psychologists and clients by using the guidelines that psychology following to ensure the sections are fairness, respect, and care of client well-being. It also helps to protect clients from harm, maintain confidentiality, and promote trust in the profession. So here is where we conducted a short interview with a clinical psychologist to address the issue and share her insight of refer or not to refer the client based on ethical and conduct guidelines.
Good afternoon, Miss. Thank you so much for taking your time to have the interview session with us today. I'm Clarice, a psychology student from Unitar, and this is my colleague.
My name is Asmadina. You can call me Asma, and I'm also psychology student from Unita.
And we're really looking forward to learning more about your experience as a psychologist, especially when it comes to a decision-making process behind refer or not to refer.
Right.
This topic is what we learned from one of our course, Professional Ethics and Conduct in Psychology. And us conducting this interview is like to gain more knowledge and, like from an actual psychologist. So, yeah, before we start,
Yeah.
can you share a bit about yourself, like introduce yourself?
I'm Cynthia. I am a clinical psychologist. I've been practicing for more than 6 years now. I was working in a government hospital for 6 years. I resigned, and then now I'm practicing independently. Some may call it a freelancing work. Currently based in Kota Kinabalu, Sabah.
I see. Okay, really nice to know you, Miss. So I think we can start with the first question.
Okay.
So can you share a little bit what kind of problems that you have faced before? Like in therapy session?
Problems.
Yeah. Any kind of problems that you have faced, doesn't matter which is which.
Problems in therapy sessions?
Yeah.
Okay, well, that's a very general question. The first thing that came to mind is a language limitation. I can only speak Bahasa Melayu and English. And especially when I was working in the government, being the only psychologist there in that hospital, I was expected to see all kinds of patients. So there were times when the doctors would refer to me patients who not very well versed in the languages that I speak, Bahasa Melayu and English. Maybe they only speak Chinese or the ethnic language. So that's, I wouldn't call it a problem. I would say that's more like a challenge.
Challenges.
Limitation. Problems, huh? I wouldn't call any of these as problems. Another challenge in my practice, especially in therapy sessions, I would say, when patients come to me and they were not aware of what the session was for because they were referred by the doctor to see a psychologist. They never even heard the word psychology, psychologist or therapy, and they came to see me. They know what to expect. So this kind of cases, usually dropout rate will be very high. They'll come once or twice, and then they'll never show up for the following sessions. Yeah. Anything in particular that you want to know about this
No,
question?
we just want to have a starter conversation with you to know common problems that you're facing, especially during therapy session. So I'm aware that language barrier and also your client not being aware of what they're going to experience in therapy session. So
Yeah.
2 challenges for you.
At least that I can think of right now.
Yeah, it's fine. It's a good insights for us.
Okay.
So, how do you usually solve those kind of problems, especially for language barrier? Do you refer to another psychologist or you try to came up with a solution?
Well, there were cases where I would ask for another colleague, like maybe a nurse or another practitioner in the hospital. I mean, I was the only psychologist, so other practitioners could be other kind of therapists, like occupational therapist or a doctor or a nurse, to come in as a translator, interpreter. Yeah, but I'm not quite sure about the ethics of that, because these
Mhm.
interpreters, they are not trained. They're not trained in translating therapy sessions.
Mhm.
I mean, translating therapy sessions will not be the same as helping your mom to understand English, for
Mhm.
example. It's, at the shop, it's not the same. And then another thing is, I think I don't quite feel comfortable working with a translator in a session. It takes so much time, and
Mhm.
there's more in therapy than just direct translation. And without
Mhm.
understanding the languages of the patients and them not understanding me, it's so hard to reach out emotionally. Get what I
Mhm.
mean? Yeah.
Mhm.
That's one of the ways that I
Mhm.
used to try to work around this. Another one is I would consider referring them to another person. Like if they are not able to how to say this, afford private practice, then I would maybe refer them to our counselor colleagues in the clinic
Mhm.
kesehatan. Because we only have one counselor in the hospital, one counselor and one psychologist, so we were very overwhelmed. So sometimes we have to refer out as well. And sometimes when we couldn't find any other options for this patient that doesn't work for their situation, we'll just let the doctor see them, because and
Mhm.
sometimes I would kind of like train the doctors as well, if because the doctors, they are also, some of them are new in the psychiatry setting, some of them are in training, so that and they're seeing a lot of patients in a day, so maybe they will not have enough time for therapy.
Mhm.
But this is something that we work together. So at certain days, they might allocate a certain slot for therapy sessions with the patients in the clinic. So it's a teamwork as well.
Mhm.
Yeah, I think, and it's not just about that challenge, that obstacle, language barrier, but also for cases for which I feel like I'm not qualified to handle, or I don't feel comfortable with
Yeah.
managing. Yeah, so I would consider referring these patients to other practitioners, and definitely I'll inform the patient first before doing so, because we wouldn't want the patient to feel rejected.
Mhm. So we were about to ask you whether have you ever feel like you're in dilemma to refer your client to another professional psychologist or to your colleague, maybe, like besides the language barrier. Can you explain more about maybe when you mentioned that you feel uncomfortable to conduct a therapy session for your client and you feel like refer it to another colleague? So have you ever really in dilemma, like should I or should I not?
I think the dilemma is not on referring the patient to another practitioner, to another clinician, but the dilemma is more to whether I am qualified, or I am doing good for this patient. Is my intervention working for this patient? That's more of the dilemma that I'm experiencing. I have no problem referring patients to other clinicians. And that is quite common in our practice, actually. So what's important as a practitioner is that you must always be aware of your own limitations. You must always assess your own internal experience as well as your competency in that matter, right? So if you're stuck, get supervision. If it's become aware that, um, it has become apparent that this is not your turf, or, you are experiencing too much countertransference for this case, then referring the patient to another clinician would be the wise decision.
Okay. Okay. So moving on, do you have like a set of ethical guidelines before making a referral?
Ethical guidelines.
Yeah, because you want to refer it to another psychologist, right? So you must have like proper ethics guidelines for you to refer them. Maybe asking a consent or
Oh,
anything.
yeah, consent is verbal. I mean, I just ask the patient, how do I feel like, okay, for example, if this patient is not very fluent in English or Bahasa Melayu, then I'll say it outright. I'll say that I feel like it's difficult for us to communicate because you only speak Chinese and I cannot understand Chinese. So I know this another counselor or a psychologist who can conduct sessions in Chinese. Would you want to see them? They are located here. If they agree with that, then you write the referral letter or referral form. And then yeah, that's the process. One thing that I want to bring up in this regarding this topic, right?
Mhm.
I have met some people, practitioners, where they wanted like a full history of the patient
Mhm.
before accepting the referral. I will not do that because that is like writing a report, like a formal official psychological report on this patient. And then this report, if I were to write a report, it has to be given to the patient. I mean, it has to be consented by the patient to release the information, and then I can only I can only give the copy to the patient. I cannot directly give it to another person.
Mhm.
So it's so sad that there are practitioners out there, regardless of professions, but practitioners in the mental health field, who would still ask for this kind of things, which is unethical.
Mhm.
Anything else you want to clarify?
So, basically, you're taking care of your client's confidentiality to not just simply share their information. Is that what you meant?
Yes.
Okay, so moving on to the next question, which is so how do you usually follow up with your clients after the referral issues? Do you still follow up with your clients, or you just like let it another psychologist handle that
Yeah.
client, or you do some few follow-ups? So can you explain to us a little?
Yeah. Once I refer them out, means that we terminate the session there. We terminate it, then there's no more sessions unless they want to book another session. So there's no reason for me to contact the patients or the clients, because as a therapist, you cannot be like a busybody, you know. You want to know how they are doing. They're not your friends. So that's the boundaries in the relationship, in the therapeutic relationship. So I always tell my patients that they can reach me out via this phone number or this email address. They can contact me anytime, and they can book another session in the future if they want to. But that is up to them. I am not obligated, and I think it is not ethical for me to follow up after the termination of the therapy.
Okay, so this will be the last question. How do you feel about referring a client? Do you ever feel like you're abandoning them, or like they will feel offended because like they thought you don't want to deal with them anymore, something like that?
You know, no, I don't really. I maybe in the beginning of my practice, and maybe once in a while, but not often now. However, you must be aware that this kind of feeling, it might be counter-transference. You might want to ask yourself as the therapist, why do you feel this way?
Yeah.
Right? Why should you feel that way? I am not abandoning the patient. I am referring them to another person because I believe that this person can provide better care than I can. So why should I feel bad? I'm doing what I think is better,
Yeah.
for them, and with their agreement and consent as well. Yeah.
Okay. So I think that's all from
Oh.
us today. Thank you
Okay.
so much for
Right.
taking your time to answer our questions and to share your valuable insights to us. We really appreciate it.
So that's all for the interview section. I hope you guys gained some knowledge after watching the video, and we want to thanks to Miss Cynthia for participating in the interview sections. Bye bye!
Excuse me, miss. I'm Asma. I'm a psychology student. Can I ask you a quick question? But before that, can I ask your name first?
Sure, my name is Harry.
Okay. So what we're about to ask is regarding ethics in psychology. So how would you feel if your psychologist wants to refer you to another psychologist or to her colleague? Would you feel offended or would you be okay with that?
Okay, Asma, thank you for the question. To answer your question, first I would feel very nervous and unsure. But then I understand that my psychologist wants the best for me. For example, if my psychologist refers me to someone that specializes in trauma, because they're not in that area, I think I would appreciate their honesty and care in because they want the best for me, right? So yeah, I think I would appreciate it.
Okay. Thank you so much, miss.
Hi, excuse me. Do you have a minute? Yeah, sure. I'm Clarice, a psychology student. I would like to ask you a simple question, but first, may I know your name?
I'm Chris.
All right, nice to meet you, Chris. Okay, my question is, what would you feel if your psychologist referred you without discussing it with you first, or like without your consent?
I think it would make me feel like I was a part of the decision about my own care, and it made me wonder, did I do something wrong or was I too much to handle?
I see. All right. Thank you so much for your answer.